Hello everyone, this is Hassan Bays from the Wednesday University Family Medicine Program. I want to first start out by thanking my team for all their hard work, specifically my advisor and mentor, Dr. King. Our QI project is titled Increasing Physician Confidence and Consistency in Controlled Substance Prescribing via Education and Office Policy. I'm going to start out with giving an overview on controlled substances, their effect on our community, and government regulations. We all know opioids, benzos, stimulants, and other sedatives are some of the controlled substances that have very important medical use. However, they can stimulate the reward center in our brain and lead at times to misuse, substance use addiction, and other serious consequences, and that is regardless of schedule classification. CDC guidelines recommend that patients on opioids have periodic urine drug screens, and in 2017, the Michigan legislation was enacted to require prescribers to be in a bona fide prescriber-patient relationship prior to prescribing any controlled substances. Additionally, patients receiving Schedule II opioids must sign an opioid start talking form which outlines risks of opioid. Now, given the multiple levels of institutionalized recommendations, it has been a challenge for physicians to know how to legally and safely prescribe controlled substances, and many report concerns about insufficient training and do not feel comfortable prescribing them. And despite government regulation, prescription drug misuse have persisted. If we look at the diagram on the left, it shows the number of overdose deaths in Michigan on the y-axis and the year on the x-axis, and we can see how every year we have more deaths from opioid overdose in Michigan. And given the importance of this subject to our community, we decided our QI project should target this topic. So we used the PDSA model for this quality improvement initiative, which aimed to ensure patient safety by increasing physician confidence and consistency in controlled substance prescribing to 90% in our family medicine clinic. We focused on increasing rates of signed controlled substance agreements, signed opioid start talking forms, and obtaining urine drug screens. So our plan was to first get a baseline assessment and do a chart review to determine physician prescribing consistency from July to September 2019. Our next plan was to revise our controlled substance office policy to clarify the policy specifically in regards to urine drug screen and chart documentation. And then we wanted to provide education intervention to review the controlled substance office policy and provide education on controlled substances and urine drug screens during didactics through handouts and clinical scenarios. And our last plan was to evaluate prescribing confidence through surveys sent to physicians and residents and case scenarios, and to evaluate prescribing consistency with post-intervention chart review for 1 month. So the prior office controlled substance policy at our clinic was revised to include requirements for an annual urine drug screen, signed controlled substance agreement, and opioid start talking prior to issuing any prescriptions, and to document those in our EMR. Using presentations during our monthly staff meetings, we educated physicians on state law and our updated office policy. The education also included interactive clinical scenarios about controlled substance prescribing. Surveys assessing physician comfort and knowledge in controlled substance prescribing was administered before and after the intervention. So this is our first study diagram. It shows the controlled substance prescribing policy compliance. On the y-axis, we have the prescriber compliance, and on the x-axis, it shows the annual controlled substance agreements, the annual opioid start talking forms, and the annual urine drug screens. So for the pre-intervention, we had 123 prescriptions, and for the post-intervention, we had 47 prescriptions. As we can see, 71% of prescriptions had documented controlled substance agreements pre-intervention, compared to 74% post-intervention. 63% had documented urine drug screens pre-intervention, compared to 76 post-intervention, and the opioid start talking implementation increased to 40% post-intervention compared to 36% pre-intervention. This is our second study diagram, and it shows controlled substance prescribing comfort data via physician survey. And we can see pre-intervention, 23% of physicians reported they strongly felt comfortable prescribing controlled substances compared to 41% post-intervention. 36% felt they strongly understood state laws compared to 64% post-intervention. And finally, 36% felt they strongly understood office policy for prescribing controlled substances pre-intervention compared to 59% post-intervention. So our study showed that an education intervention coupled with a clear controlled substance prescribing policy can increase controlled substance prescribing comfort and consistency. However, we did not reach our goal of 90%. We will definitely need to monitor the efficacy over a longer intervention period. Also, increases in understanding state and office policies did not equate to increased prescribing comfort, and so our next step is to understand what physicians need to increase controlled substance prescribing comfort and use this info for our next intervention and PDSA cycle. Regarding prescribing consistency, only 40% of charts had opioid start talking compared to nearly 75% for controlled substance agreement in urine drug screens, and hence our next step will be to train our MAs to assist us with policy compliance. I'm going to end this with figure 2, which shows a direct relationship between prescribing rate and overdose deaths in Michigan, which further highlights the need for improving physician comfort level in order to improve adherence to controlled substance policy and prescribing consistency, which will ultimately lead to decrease in overall patient deaths. These are our references. Thank you.